Hello, good evening, and welcome to the Functional Solution class and podcast, where we dive into the root causes or epigenetic causes behind the conditions that so many of our chronic patients are struggling with. My name is Tal. I'm the educational director at the American Academy of Functional Health, and with us we have Dr. Kim.
Hello, everyone.
Good to see you, Dr. Kim.
Good to see you. Good to see everybody.
So every week on Wednesday evening, we connect with each one of you to talk about what are some of the mechanisms behind chronic conditions, what are some of the, we call them epigenetic factors, the factors that turn on or off the genes of disease or dysfunction, and unique strategies that you can utilize from integrative or functional medicine to support your patients and get better clinical results. That's what we're all about. And today I want to bring in Dr. Kim, who's been a practitioner for many years and also worked as a professor in the NP program. So, Dr. Kim, it's such an honor to have you here.
Honor to be here. Thank you.
And I know that one of the most wonderful things in the many conversations that I had with you before is that, and that I found interesting, is that you created this really amazing way to combine primary care with integrative and functional medicine, which is really cool because a lot of practitioners reach out to us all the time and they're asking us, I really want to do this, I really want to find more ways to help my patients, right? I really want them to actually get better. But I don't know how do I combine this with primary care? And you've doing this wonderfully, and we're also going to see examples of that. So you want to share a little bit about what made you initially kind of go into this field?
Most definitely. I'll try to be quick with this, but initially I was an exercise physiologist, and my degree was in exercise science and exercise physiology. My first degree that was before I became a nurse, and so that right there kind of set the foundation of wellness for me because I had background in physiology, nutrition, and really valued food is medicine, activity is medicine from the get-go. And then in my career as a nurse, believe it or not, I've done a couple different things, but I did ER trauma care, and I saw lots of people coming in with big bad things that we can prevent, like heart attacks and stroke. And I just wanted to further that along to help more in the realm of prevention. Excuse me. So I went back and got my family nurse practitioner, and I've been a nurse practitioner now for going on 2 decades. It doesn't seem possible, but it's going on 2 decades. And I always had this goal of incorporating integrative health with primary care. So I started in primary care as the nurse practitioner that had the supplement list. So all of the doctors were coming to me like, my patient's on this supplement or that supplement. And I always try to really take the time with patients to go over the importance of, it's not just lip service at the end of the visit. Hey, you need to lose weight and eat better. It's like that needs to be the meat and potatoes of our visit. What are you eating? How are you moving? Do we need supplementation? And so fast forward to 2015, I'm a nurse practitioner. I have a doctorate of nursing practice. And in the state of Minnesota where I practice, we have full authority practice. And that went in effect in 2015. And in 2015, I opened a practice that was completely integrative, East meets West type of thing, where we had longer visits. And you can do a lot more with lifestyle change when you incorporate functional medicine and longer visits. So I've been doing this for quite some time. That's actually what my doctoral project was about. I've gone to Ireland and presented on how important it is that we need to change primary care and really spend extra time with the patient with a functional medicine focus. And it's funny, it wasn't just the Americans in the audience. This was international. So multiple people from multiple countries sat after the talk talking about how bad we need to change primary care and add in things like functional medicine. So I'm very passionate about it, if you can't tell. I still teach, and I do teach in the DNP F&P program. And then I do have an integrative course that I lead, and then I have my own practice. And it is an integrative East meets West practice.
That's incredible. I love that combination because they're getting from you something unique that they're just not getting anywhere else, right? It's the combination of let's manage your symptoms, which is needed in the standard of care, with the combination of but let's get you better while we do it. Let's improve your health and function while we do all of that, right? So
yeah, it's true prevention. And I feel like mammograms and those type of things, we're talking early detection. True prevention is functional medicine.
Yes, absolutely.
And lifestyle.
Yeah, absolutely. I completely agree with that. That it has to be. It's a really good integration, and even I always tell even practitioners that are just using integrative solutions, right? If it's talking to your patient about a certain dietary or strategy or lifestyle strategy, or even one or two supplements that can make a big difference in supporting their normal function or healthier function, 2, 3, 4, 6 months later, the patient could be in a completely different place rather than slowly losing their function and health, right? Which we're seeing a lot in healthcare, unfortunately.
Exactly.
So for today's class, we have something a little bit different, and I'm really excited about this. We're actually gonna have a perimenopause case that you're gonna be you're gonna be presenting, and we'll kind of both talk about talk a little bit about what this particular patient was going through, how was integrative and functional medicine kind of used side by side with the, let's call it the standard of care, or which in this case would be hormone replacement therapy. And so how can we do that and look at the root causes and go beyond just a prescription and sending the patient home? So I know that this is a very important topic, especially because hormonal imbalance, menopause, it's such a big topic. It's like nearly 1 in 2 women, according to some statistics, some surveys worldwide, would struggle at some point in their lives. So about 50% of women. So it's very, very common. And just looking at some of the interesting other statistics of it, like JAMA International in JAMA Internal Medicine in 2015 published a survey that showed that hot flashes impacts 3 out of 4 women during menopausal transition. And then we got close to 60% of women struggle with sleep disturbances and night sweats. Mood changes, 1 out of 3 women struggle with mood changes. And of course, the persistent weight gain is, of course, another struggle. So with most of this, it's really hard for a primary care practitioner to really dive deeper, right? Especially in the framework of standard of care. So that's why I'm so excited about this case, Dr. Kim. And will kind of take us, the cool part about it is that today, Dr. Kim is going to show you the entire process. So if you're thinking about doing functional or integrative medicine, or you're already learning functional or integrative medicine, then this will show you the beginning, the initial visit, the lab reviews, the functional lab reviews, and we'll share with you the treatment protocols and results, which is really cool. So we're very excited about it. So Dr. Kim, take us into the case.
Yes. So so what we have for this case is we have a 43-year-old female, and she was seeing me. Her main concern was, her hormones were off balance. She literally, when she made the appointment, she put in the little comment section, "I need help. My hormones are a mess." That's literally what she put. And she was referred to me by another one of my patients. She'd been having a lot of brain fog, hair, and fatigue, a lot of fatigue, daytime fatigue, hair loss, weight gain. She had gained approximately 20 pounds over about the last year and a half. She had noticed dry skin. She'd also had paradoxical insomnia. And so she's having insomnia. She's not sleeping at night, but she's also tired all day, and all that kind of makes sense. When you think about the main symptoms of menopause, she was having them all. That's sleep disturbance, headache, not so much the hot flashes, but she definitely was having the fatigue and the weight gain. So a lot of those things were present. All she had done for the hormone part so far, she had gone to her OBGYN, perfectly fine. That's what most people would do. When she went to the OBGYN said, well, she's not menopausal yet. So remember that the asterisk is she's perimenopausal. So she's still getting periods. And the OBGYN said, well, you're on the NuvaRing, so let's just keep you on there continuously. So no break. And let's see if that makes a difference in your hormone levels. And that was it. And she came to me and she said, this isn't helping. I'm not feeling any better. She had, stress and anxiety as well, going on. So with that said, her preventive care was a little behind too. She had her last general physical a couple years ago. At her last general physical, her A1C was normal, and she had pretty much normal well labs. Sure, her pap smear is up to date. Mammogram was now due. Last dental visit, well, she goes a couple times a year, no major concern. She goes every 6 months, and her last eye health exam was 2 years ago, and it's due now. So we always kind of hit on, remember, my clinic's east and west, so I hit on some of the primary care type of things. So in her intake, then we have a whole functional medicine intake. It's very similar to the intake form that you guys get in the certification class. So that form's a wonderful form. We also have some questions we ask when we're live with the patient. So what I gathered from that intake is that, we talked about things that were really outstanding to her as far as if you could pick 2 or 3 things that are bothering you the most right now, no more than 3, tell me what they would be. And she said, my fatigue and my weight gain and my brain fog. And that was her main top 3. So it's important to know when we evaluate hormones in functional and integrative medicine, we do expand that conversation because just instead of prescribing hormones, we're trying to understand what's causing this endocrine imbalance. Hormones are influenced by gut function, environmental exposure, nutrition. And then, for example, your gut plays a major role in estrogen and metabolism clearance. So there's a picture we can take a look at. And this picture shows how gut health influences estrogen balance. And so as you can see, from A to B to C and to D, it has quite a big role. Estrogen is processed in the liver, but it's sent to the gut to be eliminated through the stool. But if gut transit slows, then you have constipation. Certain bacteria can deconjugate that estrogen, is using an enzyme called B-glucuronidase, allowing it to be reabsorbed instead of cleared. And so remember, estrogen is, yes, it comes from the ovaries, but you can get estrogen from other sources, right? And so you can have total body estrogen. That's one thing you can measure. And then there's estradiol. That's another thing you can measure. And your total body estrogens are more than just what your ovaries produce. So that includes that estrogen that's being reabsorbed back into your body and not cleared. And that can worsen symptoms in estrogen dominant women, like heavier periods, PMS, and breast tenderness. But, it's important to know how, gut health can influence estrogen balance. It's huge. We don't want to forget that. And then factor 2, we have environmental exposure. Some chemicals in our environment can mimic or interfere with our hormones. Example, BPA. Let's talk about microplastics. It's found in many foods and packaging. It can actually act like a synthetic estrogen. And with that said, it contributes to similar issues like abdominal weight gain, mood changes, and irregular cycles. So a lot of these are hitting on high estrogen levels, and that's environmental type of stuff. And the nutritional deficiencies. So let's think about this. Vitamins, micronutrients play a big role in how estrogen is managed in the body too. So, for example, low magnesium, B vitamins, or iodine can disrupt hormone pathways, making it harder for the body to balance estrogen and progesterone. This often shows up, remember this is key for this case, is fatigue, anxiety, sleep issues, and more intense menopausal symptoms. So in this case, it really factor number 3 was really a big key here, as you'll see. Now back to her wellness questions. So I told you we did a much more, a bigger intake, a functional medicine intake. And her wellness questions showed that this patient has multiple modifiable lifestyle and environmental factors that might be contributing to her hormonal imbalance. And that included high stress, poor sleep, sedentary lifestyle, and a highly processed food diet with low nutrient density. So we had a lot of things we can work on just from a lifestyle perspective, right? So much of that, if not all of that, guys, is functional medicine, right? And so you don't have to be an MD or even an NP to work in that stuff, right? That's turn on your functional medicine and go. Environmental exposures such as chemicals, products, past water damage, metal dental fillings, and predominantly non-organic foods may further strain detox pathways and endocrine function. Gut microbiome also influences that she had some gut microbiome issues and a history of significant childhood trauma susceptible to cortisol dysregulation. Inflammation and impaired estrogen metabolism. Overall, these findings suggest a need for the following: nutritional optimization. We had to work on her diet. Stress regulation. Improved sleep hygiene. We had to work on her sleep, and targeted environmental support. So with that said, she had diagnoses that, you do your intake. And for those of you that are in traditional medicine, it's history, it's physical exam, and then it's a diagnosis. And so the diagnosis, and certainly these can be functional medicine diagnoses too. And they would be symptoms of perimenopause, weight gain, and fatigue were the main diagnoses we were going to be zooming in on with her. Okay. Since she had not had well labs in a while, I wanted to be really comprehensive with her because, she hadn't had lipids or anything like that for a couple years. So we did several different tests. For hormone and well labs, I'm going to let you know the gist of what we did, and if it was normal or not normal. So she had a normal lipid panel. That's good. That's good considering the lifestyle wasn't so great. So she had a normal CBC. That's a complete blood count. Red cells, white cells, platelets, they were fine. Vitamin B12, it was 294. Now that's low normal. I really prefer my patients to be at least 600 or above with their vitamin B12 level. Now there is an upper limit. You wouldn't really want them much over 1200, but 294 is pretty low. And vitamin D3, that was the one supplement she was taking. And it was 56. Optimal range really is about 60 to 80, but she was really close. And I'm like, this is good. This is a good thing. I'll tell you a little tidbit on vitamin D. At least here in Minnesota, we live above the 34th parallel when you think of longitude, latitude. If you are that far away from the equator, you could go stand outside completely naked in the wintertime and you're not going to absorb much vitamin D from the sun. It's just not good. The rays aren't going to hit you right. So, my practice has been here for a couple decades, and I can count on my hand the times I've seen people in 60 to 80 range with their vitamin D when they're not supplementing. And one gentleman that came to see me, he lived full time in Puerto Rico and just came up here for medical stuff. So she gets a good job on the vitamin D3. Her DHEA was 77, and that's low normal. Okay. I like to optimize DHEA carefully in women. And there's different types of things you can follow on exactly what and how to do it if you need to do it. And there is some varying opinion about it and some really good studies out there on DHEA. So I would encourage you to just read up on all the good studies on DHEA. There has actually been studies, and this is, I could throw this in later, but you could Google this study. It was, they gave DHEA to mice that had actually breast cancer, and the mice that had breast cancer, the ones that took the DHEA, instead of making it worse, it made it grow slower. And that's almost opposite to some of the other things we've seen. We've seen some big warnings on don't give someone DHEA if they've ever had breast cancer. So DHEA, I feel like, and I've done a lot of personal research on this as far as the reading goes, it is safer than we think. You just want to be careful with your dosing. Okay. Anyway, enough on that. I would like to probably see hers a little higher. Her FSH and LH, that's the follicle stimulating hormone and luteinizing hormone. Those are the two that kind of make a woman ovulate, right? So they kind of stay at this level until it's time for ovulation. And then the estrogen drops, progesterone peaks, and then the woman ovulates. That's how that whole thing works. Now, your FSH and LH go very high when you're menopausal. She was not there, so she wasn't in the menopausal range, which tells us she's perimenopause. She wasn't having cycles because she's on continuous NuvaRing birth control. Remember that. So we kind of had to rely on some lab work to give us some information about menopause. And she would be kind of young to be going through menopause. It's not impossible, but 43. So her progesterone, though, and estrogen or estradiol were at menopause level. So her progesterone was less than 0.5. That is postmenopause level. Her estradiol, now note I'm saying estradiol. I checked that because I wanted to check to see what her ovaries were doing. Estradiol is right from the ovaries. You can also check total estrogens, and that's all the estrogens in the body, the stuff that's being reabsorbed, stuff that's not coming from the ovaries, stuff that's coming from possible environmental exposure. So her estradiol was low, progesterone was low. Her testosterone was fine at 37. Women's range of testosterone is much lower than men. Women, it's usually like 3 to 50. That's where we're supposed to be. So she's right there kind of in that above 30 mark. So I'm like, okay, testosterone's not so bad. But definitely estrogen, progesterone were. Then we did functional medicine labs. So the above labs, I use Ulta Lab for those of you. I've done several coaching calls that everybody wants to know what labs I use. I like Ulta Labs for my blood draws. It's a cash lab that's very affordable and people don't have to worry about insurance. The other thing that our clinic is a direct pay clinic, so we don't use insurance. However, for visits, if patients want to use their insurance for lab work, they could go also through LabCorp. But anyway, the above labs I just spoke about were all from a blood draw. Ulta Labs, I believe patients can go there and self-order in some way, shape, or form. For those of you that might not be at NP or MD or DO, just FYI. Now, the functional medicine labs that we did, my clinic uses Genova Labs. It's a great lab, but there's lots of great labs out there, right? We just happen to use this one. I'm very comfortable with their panels. So she did a Metabolomics Plus. This is a comprehensive functional nutrition test. It evaluates micronutrient status, gut metabolites, oxidative stress, and detoxification capacity. So if you can see those buckets there, it looks like kind of 5 different buckets related to kind of what's going on inside the body from a metabolic point of view. And when I'm going over this with patients, I tell them these buckets are not silos, right? They're like dominoes and they all can affect the other, right? So she had a few things going on there. She had a major omega-3 deficiency. And then and some other things going on that are probably causing this methylation need for support in that department. So let's see. results. So the results, this page, if you could show the next picture, that's great. Thank you. So really you can see from this picture, and I don't know if you can zoom in a little bit on your own if you want to with your screen size at home. With that said, she is very low in B vitamins. The second column down, so the first column is all antioxidants. We'll just start there. She looks pretty good. She's in the green except for alpha lipoic acid, okay? And we know alpha lipoic is a very important antioxidant. This test, a cool thing, side note, shows her what foods contain all of these things and how we can work that into her diet. And we talked about that, but I'm going to also talk about it from a supplement point of view. Her big need was those B vitamins. If you look at the next column down, she's all red and, well, she's all yellow and red. So big deficiencies there. She was deficient in magnesium and manganese, and her essential fatty acids also were very deficient, showing she needed 2,000 milligrams a day. She also, I don't know if the next picture has, Yep. So this is just continued on down. It's showing, now the metabolomics is not like the GIFX from Genova. GIFX is a test that if you want to look at the whole microbiome, you can. I didn't do that with her because she had no GI symptoms at this point, so I went metabolomics instead. It does still give you a little hint of GI support. And she needed digestive enzyme support. And then she also needed some gentle support in the way of probiotics. She's in the green. They still recommend like a 10 billion unit probiotic for her. Then if you go down to amino acids, so amino acids are so important. They do so many different things, and there are building blocks for a million things, right? But look at her glycine. That I really zoom in if something is over 2,000. Certainly the things that are zero, she's probably getting plenty of through her diet. But the glycine being that big of a need really, really triggered me, because that glycine, if it's off, it affects mood, it affects weight, and it affects hormones. And she had all of those being affected. So we can't forget our amino acids either. So she had some needs for omega-3, vitamin B6. Again, why are these important? Well, omega-3, highly anti-inflammatory, and they're good for neurotransmitter balance too. She has had, issues with this being very, very low. And here's some things that low omegas can contribute to: hot flashes and night sweats, mood changes, brain fog, and cognitive decline and joint pain. Well, she was definitely having the moodiness. Maybe I didn't mention that, but that was one of her things as well when she mentioned all of her symptoms. But the brain fog and the fatigue were in her top 3, remember? And gosh, that's with omega-3. That's also with glycine. Guess what? That's also with B vitamins. And so she was really having a lot of needs here. So now if we talk about, what to tell patients and why you still consider trialing why you should consider trialing omega-3 is omega-3 supplementation may help with these symptoms: hot flashes, night sweats, in some women, especially in the doses around 1 to 2 grams a day of EPA or DHA, or, a mix of both. Because evidence is mixed, it's best considered as a supportive option, not a guaranteed cure. Monitor symptoms closely. If after 8 to 12 weeks there's no improvement, reconsider or adjust the strategy. Dr. Tal, I've been going for a bit. Anything here before I?
Yeah, I think the metabolomics is, I love that you bring the metabolomics up and you utilize it, because if there's like one lab that gives us so much information, right? It's probably metabolomics. And I know you're showing us, like, there's so much that we can unpack just from the first 3 or 4 pages, right? It's like, this is like I forget, it was like over 10 pages of information. And then it goes into cellular function, organic acid. It goes into markers of neurotransmitter imbalance. So it's fascinating. But of course, we're limited on time with this class today, and we want to kind of focus on the case. I think there's a couple of things that I wanted to mention that are that you talked about that were really important. This patient had was on the lower normal side of vitamin D, right? So reference range, we might say it's normal, like a standard of care provider would say.
Oh, sure. Western medicine, they'll say 30 is great, but it's not optimal.
Exactly. And that's really why it's so important to learn the integrative approach, because you're getting like a whole new understanding of physiology. And while the reference ranges are like the minimum to essentially keep you functioning, that doesn't mean that you're functioning optimally. So that's one thing. The second thing I wanted to mention is that even if vitamin D is which is super important for endocrine function and inflammation, all of that stuff, even if the patient was taking, you mentioned the patient is taking vitamin D, right? And it's important to mention that vitamin D without other nutrients, such as let's say magnesium, it seems like she had a higher need. Magnesium was in the yellow range. And this is just as an example. Vitamin D goes through 2 enzymatic conversion in the liver and kidney. And both of them require magnesium. And also the activation of the vitamin D receptor requires magnesium, not just vitamin D, but also magnesium. And so a lot of patients are taking vitamin D, a lot of older patients taking vitamin D, and they're thinking to themselves, I'm all good. While magnesium there's studies showing over 50% of the American population is deficient in magnesium or don't consume sufficient amount of magnesium. So I'm so glad that you brought this test, because it is from any provider that go through training of a functional or integrative or both. Now they can look at their patient in a whole different point of view.
Whole different light. And
absolutely.
My Genova rep, when I very first started, and I've been with them now for about 3 or 4 years, they're great, by the way, in the way that they will counsel you. They have education on any test you order. Excuse me. So that's really nice. So if you have a result come back and you want to go through that with them, and they'll have a teaching session with you, they will, because it is 14 pages of information. I usually give my patients like the first 4 pages. What's really nice that I didn't show, obviously there's a lot we left out, but where it shows all those vitamin deficiencies that she was low in, it also shows the next few pages what foods she can eat and incorporate in her diet to bring those levels up naturally, in addition to, supplementation we talked about. So, and then the other thing on vitamin D, I have to remind people it's a fat soluble vitamin, so you need to take it after a meal. So I have, vitamins A, D, E, and K really shouldn't be taken on an empty stomach. People forget about that.
Exactly. And it's those small things that we're like, oh, it's like a tiny little tip, but it can make a difference, such a big difference for the right patient or for a lot of patients. And of course, one of the major reasons why the functional medicine programs that we have a mentorship and a virtual clinical rotation. I know that you're one of our mentors, and we also have Dr. Esha and Dr. Chill, is because to take all of these labs and with the medical history and additional labs, and to have an experienced mentor that you can submit all of this through a HIPAA compliant portal, and then literally go with them for like 45 minutes or an hour, just it's like when I went through that years ago, to me it was like, wow, it's like it puts everything that I learned in class into like a clinical application, right? It's the medical rotation that is missing with so much of the functional medicine classes, right? So that's why I think it's so important. And of course, there's there's another part to that, which is we're going to talk about in a minute. I'll talk about adrenal and the results,
Yeah.
but
Yeah.
I know you want to talk some more about the vitamin B and
Yeah.
B6. So
yeah. So again, she was low in like all the B vitamins, you guys remember, right? So B6 was one that she was really quite deficient in. And by B6 helps with serotonin, dopamine, GABA. Let's think neurotransmitters, and if we think about the neurotransmitters that play a role in anxiety, which she was having, and some mood swings, but that's another sign of menopause as well as the mood swings. It's serotonin, it's dopamine, it's norepinephrine. GABA is going to help with sleep, right? So these are all things that are, because of B6, we're not getting these other things to the right level, right? Everything again is like dominoes. It's like building blocks. And when you really start to study organic acids and the Krebs cycle and converting food to energy, you realize what a big role all these B vitamins play, like B6, like magnesium. They all play such a huge role, especially all of the Bs, literally in converting food to energy. And she had such deficiency, and low levels of B6, for example, can cause depression, anxiety, mood swings. It can, because of those impaired neurotransmitters, right? It can cause PMS-like symptoms, and it can cause sleep issues. Again, that's, a need for melatonin production, but also GABA. GABA is so calming for the brain, and she's having trouble with that because of the B6. And it can cause fatigue, low level. So it says here, when estrogen fluctuates in perimenopause, we rely more on neurotransmitter and detox support. Low B6 can worsen both hormone-related mood and energy symptoms. And so she, again, this was huge. And I want to highlight again that this test, there's no way. I mean, maybe there's a way, but it's highly unlikely you're going to find a primary care provider that's going to order this test. It's going to be functional medicine. It's going to be us ordering this test. And look what we found. It was so much more than just take your NuvaRing every day continuously, or use it every day continuously. It was, wow, we have a lot of things to look at related to these nutritional deficiencies, right? So with that said, I'll have Dr. Tal jump into the next test.
Okay, awesome. And I'm so glad again that you brought this up, because it's a beautiful example of how you can do standard of care with integrative medicine and functional medicine. And just by looking at some of these results already, we can kind of see a picture of everything that might be holding the patient back from getting better, right? So, and a lot that we can do. So the next test that we're going to talk about is the adrenal profile. So this is called the adrenal cortex stress profile, and this is again by Genova Diagnostics. And just to give you a little bit of a background on what we're actually measuring. So in the traditional standard of care, the practitioner might test levels of cortisol or DHEA in the morning. And while that gives us some information, we have to remember that cortisol levels change throughout the day. And the cortisol levels indicate what is the HPA axis function, or the secretion of cortisol, right? So cortisol, if you're only measuring in the morning, you're missing 75% or 80 or 90% of the picture, because cortisol levels could fluctuate all day long. And they should be higher in the morning and very low towards the evening. So especially when we're talking about a patient that might struggle with fatigue, sleep issues, weight gain, mood disturbances, hormonal imbalance, all of these could be impacted by a dysfunctional HPA axis. So we prepared you to make it more visual and make it more interesting as this kind of learning experience, that journey that we're going through together. I want to share this interesting picture. So on the top, you can see this is the HPA axis, which essentially means if there's a stress signal, it's going to go into it will be perceived by the hypothalamus. That will stimulate the pituitary, and that stimulation will go down into the adrenal. Of course, this is a hormonal stimulation, and so But now we're going to go beyond the anatomy and physiology one-on-one, right? And this is where we're looking at the impact of what would the constant or dysregulated secretion of cortisol could cause to a patient, to the other parts of our endocrine system. So we're looking at impact on the sex hormone, most notably the estrogen and progesterone. So for example, when the body prioritizing cortisol production because the patient is stressed all the time, or maybe they lost that regulation of stress response, then now all the resources are being diverted away from making some reproductive hormones, and that could lead to hot flashes or contribute to lower libido, weight gain around the midsection. Think about, and I'm not going to get in too much into it, but cortisol. Every time we secrete cortisol, it triggers in our liver gluconeogenesis, which elevates our sugar levels. So think about a patient just sitting there and in the evening, and suddenly they're getting this anxiety or they're thinking about something, that they're experiencing stress, and their body starts secreting cortisol and the sugar level goes up, right? So this is one of the mechanisms you can see on the bottom left. The second one is interference with our thyroid hormones. So even if you do a testing on a patient's thyroid and you're saying, well, TSH looks okay, T4 looks okay, it in some cases it might be insufficient. And I'll tell you exactly why. Because high or dysregulated cortisol can decrease conversion of T4 to T3. That's the active hormone. That's what we're looking for. That's what stimulates our muscles, our basal metabolic rate. And it could also increase the conversion of T4 to reverse T3, which is reverse T3 is not an active metabolically. It just sits there. It just takes the place of the T3, and it doesn't really activate our peripheral tissue. So then you get lower basal metabolic rate, you get fatigue, you get weight gain, you get cold intolerance, you get hair loss, brain fog, right? So you're starting to see how all of these symptoms are related to what the patient was talking about, was complaining about. And we have to address the underlying causes, because hormone replacement therapy by itself is not going to fix this. So the next thing you're seeing is sleep disruption on the right side. If you just remember one thing from this concept is there's a whole class on this, but just one thing, if you remember from this concept, is that cortisol and melatonin have opposite rhythms. So if you get increase of cortisol at nighttime, your melatonin drops, which if you don't have enough melatonin, you have trouble falling asleep and all of that. The last thing that I wanted to mention, and you can see it on the bottom of this picture, is neurotransmitters. Chronic stress lowers serotonin, dopamine, and GABA. Those are our feel good, feel satisfied, feel relaxed neurotransmitters. And if you have insufficiency of those, then you got anxiety, irritability, depression, right? There's even craving and emotional eating at sometimes. So now that we kind of created a frame of what can excess cortisol do, let's take a look at the picture, the results from the patient's test. So this is what an adrenal profile looks like. And there's different labs that can do that, Doctor's Data or Genova. And when we teach functional medicine, we like to show you a little bit of both of each lab to kind of give you an idea of what it would look if you're ordering this lab or another lab. And so you can see here, if we just simplify it, you can see here the green range. You can see 4 measurements through saliva testing, so no blood draws needed. In most states, patients can actually order this test for themselves. So lots of registered nurses, pharmacists, and other practitioners, PAs, will have their patient order those labs and then come back with a result. This is essentially saliva, so the patient fulfills the sample just at home, so it's simple to do. And the result would look something like this. So you get what is the reference range, what is the optimal range. And you can see reference range could be anywhere in that yellow range, but what we're looking for is the green range. So you can see she's got a good start in the beginning of the day, 7 to 9 a.m. Then she's still within normal range, 11 to 1 p.m. But then it elevates, significantly elevates, way more than it should be in the 3 to 5 p.m. afternoon. So if you remember when we talked about excess cortisol, right, and the implication of what it can do, right? It can interfere with the conversion in the thyroid hormones, conversion of T4 to T3. It could interfere with secretion of melatonin. It can interfere with production of sex hormones, right? It can interfere with the neurotransmitters. So now we're starting to see how excess cortisol can interfere with the patient's function. And of course, DHEA was found to be within the reference range, but on the lower side. So let's take a look. So this is where understanding the mechanism, and this is how we typically like to explain it. It's like, what's the mechanism? Let's take a look at some visuals to better explain it. From there, we're going to jump into what are the labs and then treatment protocols. So these are two really, really good, great labs, I would say, very comprehensive labs that Dr. Kim has integrated here into care, and we wanted to share with you. Now, of course, with all of this, we're going to now put together a treatment protocol for this patient. So Dr. Kim, take us into what was the protocols that you used?
Yeah, definitely. So we divided up and conquered, essentially. So first of all, with the medications, there's a lot of, I'm going to give you a little tiny lesson here on using hormonal birth control as HRT, hormone replacement therapy. It doesn't always work so well because the doses are very, very small, especially with something like the NuvaRing. The doses of oral contraceptive pills and the doses of, NuvaRing, Nexplanon, any of those type of things are to prevent pregnancy, right? They're not to bring people into therapeutic range with hormone replacement therapy. So I personally, as a practitioner, I don't like to use contraception as hormone replacement therapy. Even in perimenopause, it's just not going to really do much. And as we can see with her, it wasn't doing much because what does it have in it? A NuvaRing has estrogen and progesterone, and her levels were postmenopausal. So we weren't really doing anything for her. So I had her just go ahead and stop that. And then I started her on very low dose bioidentical hormone compounded cream. We use a compound at pharmacy. And so she gets Bi-Est, which is a bioidentical estrogen, and then she gets a progesterone cream combined in there. You can do several different doses, and I always start at the very, very lowest with anybody. And the reason why is because the lower, the better. Now, we just had the FDA come out and say hormone replacement therapy is much safer than we thought. And that's good. I think a lot of us kind of already have known that because it's very protective. It's protective of the brain. It's protective of the heart. So it's a very good thing to have this protective estrogen. So with that said, we don't have to be as afraid of hormone replacement therapy as maybe we might have been. But I start low and go slow because you don't need to give a patient more of anything than they really need, right? And you don't just treat to a number when you're doing hormone replacement, you treat to symptoms and the number, right? So we know her number was really low and she was symptomatic. So I just went with the lowest dose there. Again, that's a cream and she applied it every day. And it's a combo cream. Then supplements. She had a lot of, needs for those B vitamins and a few antioxidants. So daily with a meal. And this is so important if you're going to have your patients taking vitamin A, D, E, and K, that they take it after a meal. So it's going to absorb, right? Those are fat soluble vitamins. So I had her go with, I like Pure Encapsulations 1 multivitamin. Now, I know there's a lot of different thoughts on multivitamins, if they're good, if they're not. I think it really comes down to what are you using it with, in conjunction with, and what does that multi actually have in it. Now, the reason why I like this Pure Encapsulations 1, and I use our clinic uses Full Script. So Full Script is a great place to get well-vetted supplements, a one-stop shop with lots of brands. Anyway, so I'm not like specific to one brand of supplement. I just want good quality, and Pure Encapsulations is. The Pure Encapsulations 1 has 500 micrograms of B12 a day. And we know we wanted to get that dosing up on her, and it has a good range of other B vitamins. And then fish oil, we went with straight DHA, and there's been some studies on the anti-inflammatory properties of DHA. To me, she seemed just so inflamed with everything that was going on in her body. So I went with DHA, 2,000 milligrams a day, and that's going to be her omega-3. A lot of times I'll give folks just 1,000, but she had a really high need, if you remember, on the metabolomics. And on the metabolomics, there was a column and it shows you what they would suggest. Now, if you did every little thing individually, the patient might be taking like 20 pills a day. And we know that's really not good for adherence. Like, people aren't going to keep up with that. So I try to group things into a combo where we can get the most bang for our buck and fill those gaps, right? So I had her on a multivitamin that was rich in B, is the fish oil, vitamin D3 with K2. I always do K2 with my D3 now. Good studies that show that really helps the absorption of vitamin D3. Did 5,000 units a day. She can double the dose a few days a week in the winter, because she really wasn't low, right? But she was low in the optimal range. So she was 56. I'd love to bring her up to, into that between 60 and 80 optimal range. Trivia for you. They based the reference range for vitamin D on rickets. So if you have a vitamin D between like 5 and like 30, you shouldn't get rickets. And so we want people not just not getting rickets, we want them to be optimally healthy. And vitamin D has a lot to do with hormone balance. They're almost now starting to think of it as also, in addition to the many things it does, as a bit of an adaptogen, a hormone adaptogen. So anyway, we had her on that after meals. Then, as needed, was a B complex on high stress or low energy days. She would have a scoop of fiber, a serving of glycine, and collagen peptides, 1 scoop in a beverage of her choice daily. And those are all tasteless. So, there's lots of good brands out there. Again, I like Sun Fiber for the fiber, a multi-collagen protein by Design for Health, and glycine, I believe that was designed for health. And they're all just powders. So she just puts a scoop, and I think 2 teaspoons of the glycine in something once a day. And then at bedtime, we had her on a combo sleep formula. It had the B6 in it. Again, remember, she was super deficient. It had GABA and 5-HTP. The 5-HTP is basically like tryptophan, but that's going to help the serotonin, that neurotransmitter, that feel-good neurotransmitter. All of those things, GABA, serotonin, B6, can help to relax the brain, right? And then certainly magnesium, we had her on at night. So those were the big core supplements that we had her start, along with a change in the hormones to the hormone cream. Nutritional goals, we spent a lot of time. So I have some pre-recorded classes that I'll give my patients access to here and there. There's a Nutrition 101 class that goes over micro and macronutrients, and it even can show patients how to track their food if they want to make sure, hey, I'm getting the right balance of macro and micronutrients, and why does it matter, right? Because the other thing we have to consider is she probably, as most American diets, the traditional American diet does not have enough protein. It has usually too much fat and too much carbs and not enough protein. And so I went over, I have a 1-hour class she watched about just the fat carb protein balance, why it's so important. 100 ounces of filtered water a day. that is important because she was drinking tap water, and I don't, she didn't show a lot of toxicity with her testing. But remember, guys, the tap water is just not what I don't know if it's ever been really good, but it's really not good. So I have a little handout of good recommended water filters that she could do. A good on the go one is that Nalgene. It's an Nalgene bottle with an Epic filter. It even filters out microplastics. And then I gave her a couple good ones. She could do like a pitcher in the fridge with the Epic filter, or she could put something under her sink. So I gave her some information on how to filter the water. And then the Mediterranean style eating. And really, the Mediterranean style eating is very high in antioxidants, because that the bottom level of Mediterranean style eating is actually activity. So we needed to increase her activity, and we need the next level up is increase her plant foods, right? Her plant-based foods. Then movement, really, focusing on just moving. Start doing something you like. I said, ideally, we want to get you to 150 minutes a week and 30 minutes in a session at least. I explained to her that your body goes into fat burning at 15 minutes. And so, we've had this 20-pound weight loss. We don't want to lose muscle. We want to lose fat. We need you in that fat burning zone, and we need you to be active. These vitamins won't do it all on their own, right? The diet will be a huge help, but we've got to get you moving, get your metabolism going, and build the muscle and burn down the fat. So I really like the 30-minute lower intensity sessions for fat burning, because that's when the magic happens, is at 15 minutes, after 15 minutes. So she goes 30 minutes, like a 30-minute walk. She's burning fat for roughly 15 minutes of that walk. Right. So she kind of got the wheels turning there. And I said, you don't have to start out at 150 minutes, but that's our end goal. So even if you start walking 2 or 3 days a week, 30-minute sessions, we're good. Pop on your shoes, pop in like your favorite podcast or music in your headphones, if that's your thing, and just go out your door and start walking. Because she wasn't going to the gym. She really wasn't doing much of anything exercise wise. So I just wanted her to start moving her body. And then, eventually once we get her into, and I keep following up with her, our goal exercise wise is to convert a lot of her exercise to strength training, which is very, very important in menopausal years. It's important all of our life, but you are never too old to gain muscle. And that's kind of a myth, is people think, well, you just get old and you lose your muscle and you lose your functionality. And you only lose it if you don't use it. And so if you're strength training, you'll still build muscle even in menopause, and especially when we get your nutrition and your macros right. Then guess what that does? It helps optimize your hormones. So all of these things work together. It's so important. So those were the big treatments that we did. So again, stop the NuvaRing, start the hormone, adding in the supplements, what she'll take kind of her daily handful, if you will, with the one meal. And then she would have her as needed. Except the fiber, glycine, and collagen, that was every day for sure. And then she had her bedtime, that was every day for sure. Lots of water, 100 ounces a day is what I want to see her getting. Remember, water is like one of your biggest detoxers. And it's the easiest detoxing you'll do is just drinking your water. And then those supplements to help her with sleep. And then let's see what else we talked about. So talked about a lot of those already. Now, she also mentioned, remember that her skin felt dry. Well, as we age, we make less collagen, right? And she, her vitamin C level was good in the metabolomics. You need vitamin C to really absorb the collagen well. But by giving her that collagen back, that can help the integrity of her collagen. Now, there's all kinds of different collagen. I use Designs for Health. And I tend to like their it's called Whole Body Collagen by Designs for Health. They're on Full Script. But there's lots of different ones that are out there. The most important thing is that they're, taking it and they have a healthy vitamin C level so they can absorb. She came back with just raving results. But let me see if there's a couple other things. Collagen is going to help with skin. It's going to help with joints. It's going to help with hair, nails. So let's see. Yeah, pretty much that is what we did for the plan. So we had quite an intervention with her. Our wellness plans are not just stop the NuvaRing, start the hormones at all, as you can see. So she ordered all of her supplements. She started doing the activity and really just focusing in on all of those things. And I let her know, like, it's going to take practice. And the more you do this, the more faithful you are to this, the better results you're going to see. And you have to remind people that functional medicine results don't happen overnight, right? So she needed to remember that all of this is like, she's got to believe, you just got to have faith in the journey. Because I said, the first couple days, you're not probably going to feel much. Then the next week, you might start to feel better. But imagine when we get 6 months down the road and you're 20 pounds lighter and your nutritional gaps are fixed and we're just in maintenance mode. You're going to be loving your life. So she had that good motivation. I did a quick little check-in with her at like the 4-week mark, and she was doing great. She's like, yep, Dr. Kim, I'm following my wellness plan. Things are going great. And then at 8 weeks, we actually had a visit. And nearly, you can show this if you want it. There's it's extra on here about all of her symptoms. Nearly all of her symptoms were resolved, which is crazy. Because at 8 weeks, I didn't think we would get all the way there, but we were almost all the way. It was really quite crazy. So nearly all of her symptoms were resolved. She said the brain fog was completely gone. Fatigue was greatly improved. She didn't feel that need to nap in the afternoon. Her anxiety went down a lot. And so she also felt like she could sleep better. Remember B6 and that link to anxiety and sleep. Again, she followed the wellness plan faithfully. She was feeling so much better that at that visit, we were actually able to flip over to goal setting. And goal setting is where we start to think about what's her ideal healthy body composition and weight. And usually I'll go into not just weight. When you're weighing someone, you're weighing their bones, their brain, their muscle weighs more than fat, and on and on and on, right? So we set some body composition weight goals. We set some stress goals and just personal wellness goals. And we were able to take some deep dives into what a good exercise program would look like in order for her to get to those goals, and deep dives into nutrition because she was being so faithful with her functional wellness plan. So, and the one thing she said to me that really stuck out is she said, I thought this was just all hormones. And I said, well, kind of, but it's because all of these other things that you weren't getting tested for in primary care, these B vitamins, the glycine need at 4,000 milligrams a day. All of these things help balance your hormones, and all of these things were off. So it wasn't just all about your hormones, right? So it was really cool for her to say, wow, light bulb moment. I had some significant nutritional deficiencies. I wasn't just perimenopausal. My nutrition was off. My activity was off. So this domino effect, and that's what I love about functional medicine, is we got to the root cause of her problem. It was nutritional deficiencies. And that's probably, guys, since we did all of that, that's probably going to keep her at needing that low dose of hormone replacement therapy and not having to jack that way up, right? So you can keep hormone replacement therapy lower, or sometimes, like if you've had a breast cancer patient come to you that like, I can't take hormones, fix the basics first. Do that metabolomics. Fix all of those nutritional gaps first. Work on lifestyle. They might not need hormone replacement therapy, or definitely not as much of it. So, yeah. Dr. Tal, do you want the next part, or do you want me to go in?
Yeah, we can go into that. There's a quick question. Somebody asked, what is the company for collagen peptides? Do you have a preference with that?
I use Designs for Health, the whole body collagen.
Great.
And,
yes.
Again, there's many good brands, so I don't want to say like, oh, that's the only one out there, but that's a favorite of mine.
Yes, and I know that we actually have, that's such an important topic. So Dr. Kim is using Design for Health for the collagen peptides, but make sure that you recommend professional grade supplements. We have a whole class just on that specifically, so we're not going to dive into that. How do we identify and what's the some of these certifications that you want to look for and all that stuff. But yes, that's a pretty good. It feels like, just such an amazing combination of
Mhm.
the standard of care, using all the tools we have in standard of care. And I know that lots of nurse practitioners must be watching this, or in our community are using hormone replacement therapy. But now you also know about the other side of it, which is the underlying causes, the gut, the nutritional deficiencies, the how do we use nutrients to support what it is that we're trying to achieve, and of course, how do we test? What do we look at? When it comes to HbA excess cortisol, all that stuff. So Dr. Kim is also, I wanted to mention, she's got a new class coming up for in January 5th, and that is the Functional Medicine Accelerator. So we're going to show a picture of what that looks like. And this is really our way to bring the entire functional medicine framework in 4 months. We're literally kind of designed the program to be 4 months. And every week you go into one specific root cause. We look at labs, mechanisms. Dr. Kim is going to lead the live class every once a week in the evening. And then you have everything is recorded for you. And then, of course, we have the other presenters, like we have a few physicians and Dr. Caviola, who's been a master functional medicine physician as well for over 15 years. So we got lots of really cool classes by over 10 different presenters. We got the physician also, who is being the medical director at Dr. Amen's clinic, which we love their work. So talk about some other topics. So we got a really cool program for you. It's between, I would prepare for between 3 to 5 hours a week. Most of it is on demand, so you can kind of study around your schedule. And within 4 months, you get certified. And this is a relatively new program. You also get the phone app with all our treatment protocols, the evaluation guide, the clinical treatment protocol guides. But what I'm really excited about is the virtual clinical rounds, which is not just doing case studies like we're doing today with Dr. Kim, but also going one-on-one with practitioners such as Dr. Kim and talking about your case studies, like what bring your patients to the conversation. And you can do this one-on-one with Dr. Kim or Dr. Esha. So Dr. Kim, what was your experience so far from different practitioners, either physicians or nurse practitioners or nurses, when you do these mentorship calls with them?
Oh gosh, I feel like they're just getting to the real reason why they got into primary care, because a lot of nurse practitioners are family nurse practitioners, and it's, that preventive focus. A lot of us end up in primary care, and and then a lot of us get really frustrated in primary care because we have shorter and shorter time windows with patients, maybe 10 minutes. And the one thing you cannot do well in 10 minutes or even 20 minutes is lifestyle change. And lifestyle change is really what's needed here. And we know that lifestyle change, functional medicine, closing those gaps with either supplements, with food, with lifestyle, that's what really lowers the disease risk, because that's how we really get there. And I feel like people just see that connection and they're like, I can spend more time with my patient. I can get to the root cause. Like, this just makes perfect sense. And, I think, we're taught all these things in Western medicine, but what we're not taught is some of the most important things, like the nutrition and all of that lifestyle stuff. So, I can't think of one person that I've talked to that's a nurse practitioner that it's like, oh, that stuff doesn't, like, you used to have, and there probably still are some people like, oh, just kind of naysayers and call it voodoo medicine and that. But I have not ran into anyone, even my students. I have DNP students that I'm teaching functional medicine concepts to, and they're just all like, this is what we want. This is what we want to be doing. And again, it is true prevention. It's not just early detection. It's way more than ordering a mammogram or thermal imaging on your patient, or colonoscopy. Those things aren't bad things, but they're not going to truly prevent something. They're going to catch it early. True prevention is correcting those B deficiencies, the omegas, helping someone's body composition come back to more healthy. So yeah, I could go on and on, as you can see.
Yes,
So I'll be quiet, but
I can tell you're very passionate about it, and
yeah,
that's why that's exactly why I wanted to bring you into these classes, because not only you bring it over 20 years of clinical experience, but you also got certified in integrative and functional medicine, so you know these topics inside out. You use this in these labs in your practice, and you love teaching. And I've heard amazing feedback, a lot of practitioners going into coaching with you. So I was like, that's amazing. I'm so glad, such a blessing that, we have you available for those in our academy. I'll probably add on to something, as you mentioned. I remember kind of what you were saying about some practitioners. They're kind of getting into this field, but there's initially this hesitation of like, is this like, this what holistic or alternative, or is this like what is that, right? It's like it's kind of a little foreign to them. And so it reminds me, I think it was like about 3 years ago, I had a conversation with a physician from New York, and we're talking about functional medicine, and like, he was kind of interested in that. And he was telling me like, what is, like, I'm interested in that, but can you tell me a little bit more, what is functional medicine? And I said, well, I'll try to condense it into like 1 or 2 sentences. Essentially, we're looking at we're not trying to manage the symptom or condition. We're trying to understand what is driving the disease, what's contributing, causing the chronic disease, and do more of a corrective care, right? And he told me, it was on the phone, and he said, Vital, we already know what's causing these chronic conditions. And I was like, well, what's causing it? And he's like, it's the patient's genetic. And I said, well, I mean, yes, that obviously plays a role. But why do some patients have genetic for a certain condition and they don't get the disease, and others don't and they get the disease? For example, type 2 diabetes. And he's like, well, type 2 diabetes is caused because of the insulin receptors dysfunction. I was like, okay, but what's causing that, right? So, So interestingly, he ended up enrolling in the program. I'm not sure if it was just because we really had a good conversation. He was really hesitant about it, but and again, I'm not sure what it was specifically that made him say, okay, you know what, I'm going to go into that. But we had a good conversation. He was very respectful. A few months later, he enrolled in the program. And what was interesting is that I kind of caught up with him later on. We were doing this. He went through the training, and we had this like mini 1-day conference, and we connected. And I was like, well, now that you learn the whole system and you understand, you have a deep understanding of the mechanisms, what triggers those genes, like, what do you think now about functional medicine? And you know what he said? He said, Tal, I wish I would have learned this in medical school over 20 years ago, right? And so it's really interesting how once you dive into what Dr. Kim was talking about today, like the mechanism in the labs, you see, it's like almost like you were seeing this amount of what's going on, and now you're seeing this amount what's going on, right? It's like you see the whole picture. So, so that's why I'm so glad that you brought it on. And again, we are doing everything we possibly can to share as much with each one of you in these classes, because we want you to utilize this. We want you to get better clinical results with your patients. We want your patients down the road to need less medications rather than more medication, because we know that what that means typically, that they're losing function, right? Or God forbid, develop complications, right? Or God forbid, be not dysfunctional at an older age, right? So we want the best of health. We want best function we can for our patients. We want the best outcome for them. And that's what we're here. That's why me and Dr. Kim are really passionate about. And so if you are interested in learning more, this is why we opened the 4 months accelerator for practitioners who are saying, I don't want to commit years to this. I don't want to spend, dozens of thousands of dollars or another degree. I want to learn functional medicine. I want to, within 4 months, get certified, do functional medicine in my practice. That's where we have the program. So check it out. Our team will post in the link, in the chat, the link to the enrollment. We got open enrollment. We got a scholarship right now we're also offering. This is only open to healthcare professionals. So you have to be either a nurse practitioner, registered nurse, physician. This is a high level training. So very advanced, very clinical. So it's going to be fun. I know already a few people enrolled, Dr. Kim, which is really excited. A few practitioners are already enrolled, and we literally just opened enrollment just about a week ago or a week and a half. Awesome. So we already have a few people enrolled. So that's be exciting. And we're also going to have a community where we can all interact during the week and share cases or challenges. So you're going to have somebody to talk to. And we got a whole year of mentorship. So we're going to be with you even after you graduate to help you to deliver better clinical results. So Dr. Kim, I thank you very much for taking the time to be in here.
You're welcome.
For sharing your... Thank you. That's amazing. It's an amazing case that really helps us to dive deeper into functional medicine, how to integrate both. And I appreciate you bringing it to us and for preparing all of this. And I want to thank our media team for helping us to be here with you wherever you are. And as usual, I want to thank each one of you for taking care of your community, for bringing integrative or functional medicine, bringing additional solutions and guiding them. Because as Dr. Kim was mentioning, nobody else is going to do that in the standard of care. You're probably going to be the only person they're going to meet that will show them a different path to becoming healthier. So thank you so much for everything you're doing. Have a good evening and take care in the meantime.
Bye, everyone.